about him because he just told me yesterday that he's expecting his first child on the way. That's big love. Yeah, for sure. So check this out. Last year, right about the time that he just got engaged, he decided that he wasn't feeling too well. He had a pain in his side, and he was saying, "Yo, Calvin, I've been hurting for a minute in my side, but my insurance doesn't kick in until the next week." I was like, "Doc, see that? Go to the doctor." It's like, "But that's gonna cost me." And he was talking about it, and he just said, "I'm just gonna go into work, and if that, if it doesn't go away, then I'm gonna go ahead and just go to the emergency room." Because for a lot of people, the ER is primary care, right? And he went through the work day, couldn't get through the entire day. He said he was in pain the entire time, so he decides to go ahead and check into the ER. While he was there, the doctor tells him that he's really, really close to having appendicitis, that condition where your appendix is about to burst. And they're like, "All right, you need to go into surgery." So, my cousin, good-hearted person, he's like, "All right, so when can I schedule that? Can I come in next week after my healthcare kicks in?" And the doctor looks at him like he's crazy, like, "No, you need to go in tonight." So he had to go into surgery that evening. He had to stay overnight 2 nights, and that cost thousands upon thousands of dollars. So instead of having a traditional wedding ceremony as he planned out, he decided with his fiance to do a signing at the courthouse with a smaller group because they could no longer afford their wedding because of the expenses for the ER and the surgery and the overnight stays. Think about that. He was going to get coverage within 1 week. He tried to negotiate saying, "I just had surgery, could that be covered?" But there's that little thing called pre-existing conditions. They weren't going to pay for any other the follow-up treatments, and they weren't going to cover the surgery that he just had literally 1 week, 7 days before. This is why we need healthcare reform. He's only a couple months older than me. That's our age. That's our generation being hit. That's our generation feeling this at a very personal level. Fortunately, the healthcare plan kicked in, and his wife, along with the child that's going to come, are going to be covered. But what happens if he changes jobs? You know what I mean? What happens if, God forbid, something happens and that plan actually doesn't cover what it was supposed to cover? It's these little things that show that we definitely do need reform in our system, because whether we're starting new families or you already have one, whether you got children or got some on the way, whether you're covered now or you're not covered by your employment, right now it's about what could happen. And it's not just about you individually, it's about the rest of us in our generation, the generation ahead of us, and the one that's to come behind us. That's why we got to organize and make sure that this time, in our generation, this time around, that this is going to be the last time we bring up healthcare reform. By bringing all of our power together, make sure we bring it as soon as possible. And by as soon as possible, I mean right now. So when I say healthcare reform, you all say now. Healthcare reform.
Now!
Healthcare reform.